Dr. Anthony Fauci, CDC Director Rochelle Walensky, and other top health officials testified before the Senate Health Committee Wednesday about the monkeypox outbreak. Washington Senator Patty Murray said point blank, quote, "Too many missteps were made in the response early on." Earlier this summer, the federal government faced backlash for the slow rollout of testing. The deployment of the monkeypox vaccine nationwide was hamstrung by logistical, bureaucratic, and technical errors.
Thank you very much to all of our witnesses for your testimony and for being here today. We will now begin a round of 5-minute questions of our witnesses, and I ask my colleagues to keep track of your time as always. Hopefully you can stay within those 5 minutes. I know each of your agencies have worked relentlessly to respond first to COVID and now monkeypox, but I have to say, frankly, too many missteps were made early on in the response, and a couple hundred cases turned into 21,000. It is unacceptable to communities who already experience barriers to accessing health care, like the LGBTQ+ and the Black and Latino communities that are hardest hit by this outbreak. Access to testing was an early challenge in the monkeypox response, with many people reporting significant delays in both accessing the tests and learning their results. To continue to have these challenges around testing is just simply unacceptable. So Dr. Walensky, let me start with you. How is the CDC working to make sure tests are more accessible and results are available earlier?
Thank you, Senator, for that question. One of the big challenges that we had in terms of access to testing was both patients understanding that they were presenting with a new infection, and providers understanding that this was a new infection that they had to test for. Indeed, another important clinical consideration was that people were coming in requesting a test when they had no symptoms and they had no rash. As Dr. Califf noted, the test for this infection is a swab of the rash. So in fact, there is no other FDA-approved test. We need to have a rash in order to conduct those tests. So much of what we've done, and I should mention that we've always had more capacity than we have had tests coming in. To date, we've used about 14 to 20% of our capacity. But to address these access issues, we had to work with clinicians, we had to work with patients, we had to do an extraordinary amount of outreach so that providers would understand how to test, patients would understand when to come in for a test, and our public health partners would know not to gatekeep those tests. And so that was a work that we did early on as we were scaling up testing, knowing that we may need more testing coming forward. So through the Laboratory Response Network, we increased our capacity to test through expanding the manual extraction to automated extraction. Then we worked, as you heard, through our commercial labs to expand testing across the country, and simultaneously working with outreach and education to providers, clinicians, patients, and public health. Thank you.
Thank you, Dr. Califf. Secretary Becerra recently declared that FDA can use the emergency use authorization pathway for monkeypox tests. How will that improve the availability of new tests? And what steps are you taking to improve on the progress that you've made?
First of all, let me concur with Dr. Walensky. There's never been a shortage of tests, but there's been a shortage of access to tests because of inefficiencies in the system. So the EUA authority has enabled us, we've given one EUA already, but we also have 5 commercial labs which are offering the tests at this point. And we issued a guidance just the other day, which makes it clear that individual institutions that are developing laboratory-developed tests should proceed ahead. And we've given people clear guidance and templates for developing their tests and figuring out if they work. So I'd say on all fronts, the gates are open under a watchful eye, because we also must keep in mind that one of the lessons from COVID was that when the gates were open, a lot of tests that turned out not to be so good got out there, and we had to rein them back in.
Well, look, I'm encouraged by the decline in cases, but it really is imperative that we remain vigilant. And despite efforts by HHS to increase access to vaccines, some people in my home state of Washington still go to great lengths to get one, including crossing the border into Canada. Now, people understandably want to be vaccinated before they get exposed, but we need more vaccines. So, Ms. O'Connell, some serious stumbles were made this year when it came to our vaccine supply. What have you done to make sure that that never happens again? And what are you doing to increase the supply and distribution of vaccines right now?
Chair Murray, thank you so much for that question. What's most important to us is that those that need access to this vaccine get it. So if you continue to hear from constituents that are unable to access a vaccine or having to cross the border, please let us know. We are in the business right now of knocking down those hurdles and making sure the vaccine can be accessed. We did take a very small stockpile that was intended for smallpox, that was eventually intended to be lyophilized, freeze-dried for smallpox, and convert it to this active monkeypox response. And that required a couple of challenging problems to solve. We moved the first 372,000 vials, as I mentioned in my opening statement, immediately. We needed FDA to approve, and they were terrific partners moving quickly, to approve that second manufacturing line that began drew the 800,000 vials we were waiting for. That's what it manufactured on. We needed that approval to happen before we could deploy those. FDA worked quickly, and we got those out in July. We have also ordered an additional 5.5 million vials of the bulk drug substance that was intended to be lyophilized for smallpox. We have ordered that to be filled and finished and shipped to the United States, and 2.5 million of those will be manufactured in the United States. By adding a second line in Graham, one that's onshore, domestic manufacturing, we'll be able to access these vaccines much quicker in the future, and it's a critical step forward in our preparedness, both for this monkeypox response and for future smallpox programs.
Senator Burr.